Alright, next patient. Come on in. Hurry up. I don't have all day. I'm on a very tight schedule. What? Oh my god. Did nobody out there warn you exactly what I look like? Typical. What? Did you not think that I'd be a zombie? Oh, honey, I'm one of the only doctors probably open in the whole entire world. If I hadn't already been turned into a zombie now, I would definitely not be taking patients. Yeah, I was a bit, well, early on, so I thought with my limited time that I had left here, might as well do my job, huh? So, you can either stay and get checked over by me, or you can just leave and hopefully whatever it is doesn't take you out before the virus does. Or, who knows, maybe you'd rather have the virus than whatever it is you got. Okay, well, since you've elected to stay, I'll have you know, we don't know what kind of timeline I'm on. I mean, ever since, the fall of society and such, governments crumbling, empires, poof, gone. There hasn't really been any scientists out there researching what's going on and how to fix it, so I'm not really sure how much longer I have before I become one of those shambling crawlers out there, okay? So, if I get a little close, a little lungy, maybe a little too twitchy, you may just want to skedaddle on out of here, okay? Yeah. You definitely don't want me to bite you. I will tell you, the first couple days after getting bit are hell. Night sweats, then freezing cold. But then eventually you just don't feel anything. Now it looks like my flesh is starting to necrotize, so fun. Hopefully a finger doesn't fall off while you're here. Okay, well, enough about me. What is it you came in for? A pelvic exam. Alright, yeah, I think we can handle that, but just so I make sure this isn't a waste of my time, I need to check you for bites. Because you're not gonna need any help if you've already been bit, because there's nothing stopping this. Okay? So, have you been bit? Okay, well, since I, learned my lesson with this one, I think we're gonna need you to strip and we're gonna check you for bites. Got it? Put those down. And I'm going to check every inch of your skin with this light and look over you and make sure there's no bites. Like I said, only run out if I get really twitchy. The twitching, I wouldn't say is that bad yet, but it's involuntary, so I can't fully tell how much is too much. And good news is, honestly, you stink. You don't even smell like good meat. You smell bad. I'd recommend a shower for you, honestly. Go. But maybe it was smart of you to come in here smelling like that, because now I really don't want to bite you. Okay. Looking over every inch of your flesh, just to make sure nothing shows any bites. Okay. Oh, I mean, I don't really care if you turn into a zombie. I just don't want to waste any medication on somebody like yourself. If you were a zombie, I'll give you medication if you're not, But these resources are very sparse, so it's better that I'm more safe than sorry. Now turn around. Look at your back. Are you traveling alone or with people? Don't answer. Well, smart of you. Are you just passing through or staying here? You know, answering some of the questions at least can help me determine what you could have. Know what you've been exposed to out there. Have you been on foot, or are you traveling by a vehicle, perhaps? Fine. I have no means for taking your supplies. I mean, my diet really now is only raw meat. That's the only thing that tastes good anymore. Everything else makes me vomit. Yeah, okay. Well, I don't see any bites, so we can continue on with the examination since you're not a complete waste of my time. You said a pelvic exam, right? So, what you got going on? Come on, spit it out. I already told you I do not have all day for this. Does it burn when you pee? Is there redness? Any lumps or bumps on your penis or testicles? Okay. You've had some painful urinations. Okay. When did this start? Are you having pain into your kidneys? Into your sides, in your back, like here? Don't flinch away from me. I'm not gonna bite you. Here. Not yet. Have you had any fever? Okay. I'm gonna test a few other things first, okay? We're gonna listen to your heartbeat and breathing. So I'm gonna get close to you again, so don't run off. Here, okay. And deep breath in. And out. Okay, and I'll check this lung over here. And deep breath in. And out. Good. And listen to your heart. Sounds good, but I can tell you're nervous. It's beating quite fast. Take a chill pill. I'm going to do a full examination on you since this will probably be the last time you ever get to see a real doctor in an office. So, let's move on. I'm going to check your vision. I have these two lights here. What color is this? Red? Good. What color is this? Blue. I want you to pick one of these, either the blue or the red, and I want you to follow it with your eyes, okay? Follow the light. Good job. I want you to follow the other color that you did not choose. I must be getting a little hungry. You don't smell as gross. Don't worry. I still don't feel like taking a bite out of you. Yet. Good. Now the light that you're following, is it near or far to your face? Is it near, far, near, far? Good. Now, is it near or is it far to you? Is it near or is it far? Good. Alright. Now, just looking at this red one, what shape am I drawing? Square. Good. Next, what shape? Triangle. Good. And now, What shape is this? A circle. Good. Okay, what color is this? What color is this? Which color is this? Good. And what color is this now? What color is this one? Good. Okay. That checks out. Now we're gonna use your little brain for a hot second, okay? You can see I have my necrotizing flesh fingers and I have my normal fingers. I'm going to hold up fingers, okay? But I only want you to count the ones with the dead skin. Got it? Okay. So, how many fingers am I holding up? 2. Good. How many fingers am I holding up? 2. How many fingers am I holding up? 1. And how many fingers am I holding up? Good. And how about now? None. Good. And how many fingers am I holding up this time? 3. And now? 4. Good job. You did really good. Glad you're able to think through that one, bud. Okay. So, we're going to move into the pelvic exam now. Seems like you'll probably need a course of antibiotics just based on what you've said so far since you've had this for a while. It's most likely a UTI. You've had painful urinations. Have you noticed any blood in your urine? Okay, yeah. I'm definitely leaning a UTI with this one. But we're gonna check it out. So first I'm just going to start by observing your penis and testicles now. Just look them over. Now, this right there, is that a birthmark or a rash? It's rather red. Okay. There you go. Okay. I'm going to palpate your stomach area. Please allow me to tap on you and touch you. Are you going to be okay with that? Good. I'm going to tap on you. Hopefully my fingers don't just fly off, but you never know. It's bound to happen eventually. Let me know if anything hurts. Okay. Any pain? Sorry. That was a big twitch there. I felt that one. Alright, that looks good. Now, I'm going to move on to palpating the penis itself. Again, let me know if there's any pain. I'm feeling for any lumps, bumps, anything that shouldn't be there. Got it? Got it? Okay, starting from the top and bottom of the penis. There you go. Any pain? No. Alright. I see there is some scar tissue here. Is that an old injury from before? Okay. Zippers are tricky, huh? There you go. Okay. And now going from the sides towards the head of the penis again. Let me know if anything hurts as I am palpating. There. Okay. Good. And then I'm going to squeeze the head of the penis and look and see if there's any discharge that shouldn't be there, anything like that. You can just see that your urethra is kind of inflamed and red. I can definitely see that you are not having a good time when you need to go pee. That probably hurts a lot. Well, since I don't really have access to a lab, essentially we have to guess based off of what you've told me. So, your collection of symptoms, you were being truthful, and that was all of them, correct? Good. I have some leftover antibiotics that I can give you, alright? If anybody asks, you didn't get them from here. Last thing I need is people reading it and then, taking me out because I look like a zombie, okay? Trying to do at least a couple good things before that happens. So let me grab those. Okay. Here, take the derm. Take it. You're gonna need a full course of antibiotics, so you're gonna take 2 pills a day, okay? 1 in the morning, 1 at night. You're going to start right as you leave here. Got it? Take all of them. Don't stop halfway through if you start feeling better. The last thing we need is another super antibiotic resistant bug as well on top of zombies. Okay? And if you don't take them all, it's gonna come back and your piss is gonna burn again. Got it? Good. Glad we're on the same page then. You can put your clothes back on. Yeah, I need to see other patients and you're just taking up my examination room. Alright, get out. And good luck.